Stress is considered a mental illness, but it can be a mental health problem. We all talk about stress, but we are not always clear about what is it. This is because stress comes from both good and then bad things that happen to us. If we did not feel any stress, we would not be alive. Stress becomes a problem when we are not sure how to handle an event or a situation. Then worry set in and we feel stressed. It is how you think about and react to a current event that determine whether you find stressful or fairly easy to deal with. Your reaction to stress can affect your mental and physical health. So it is important for you to learn how to deal with stress. Now, handling stress. First, you have to find your problem. What are you worried about? Is it school, your job, or your friend? And then, after you find your problem, you have to try to solve it. What can you do, and what will be consequence? Do you need to talk to a teacher or other else? And third, you have to talk about your problem. Find a friend or a family member may not realize that you're having a hard time. So you have to talk to them, talk the problem, and then try to get help. Next, learn about stress management. There is book and a website and a film video that costs to help you and then with stress. Reduce tension. You can do something like sport to keep your mind away from the stress. And then that's pretty much about it.
Hello, welcome to Youth Health Navigation Center. Today we will talk about bipolar distress. Now, why is it bipolar? The problem is they're bipolar. Basically, bipolar is their emotions or moods at one period of time going extreme. So they're maniac depression or depression. Now the maniac mode is usually during a month or a few weeks of their life. They are really, really happy. They are feeling really optimistic. They speak really fast and doesn't need much sleep. Now for depression, we have feeling really depressed, loses interest in everything, eat a lot or very little. And now the next scene, we will show you.
Okay, so we're talking about depression, and she is the one that's suffering depression, and I'm being the role of the youth health navigator.
I gotta be the depressed.
Hey, why you look so sad?
Because I have a lot of homework I didn't do it, so I'm so worried about it. I really hate my life. One day I eat a lot, I sleep a lot, eat more, I don't know why.
Oh, maybe these are kind of like the symptoms of depression. But no worries, no worries. Actually, the best way to treat depression is like talk. Talk to a person that you trust on, maybe a teacher, families, or friends. You need support from them because you can trust them, right? And also, you can talk to a doctor or a psychological counselor. They will also help you too.
Thank you, I will try.
No problem.
I think we
between depression and having a bad day because like many people get confused of these two. So for depression, it usually lasts for like several weeks, but for having a bad day, it's just only a day. It's not like a week. And for depression, you will like sleep and eat like less or more than usual, so you're like not normal. But for having a bad day, you will just feel the day like I'm like having a bad time, having a bad mood, and you won't like sleep or eat like crazy or like not eat anything. And also for depression, you will lose many energy, and then you will like feel very tired. But like for having a bad day, you will feel tired, but like not extremely exhausted tired. So this kind of basically the difference between these two.
Williamson. Today I would like to talk about a disease called schizophrenia. It only happens in 1% of the society between the ages of 16 to 30. Schizophrenia is like feeling that someone is spying on you and you can't make up your mind. You have disorganized thoughts. There are three main signs or symptoms to this disease, which is delusion, lack of motivation, social withdrawals, disorganized thinking. Delusion is like false beliefs which are not based on true facts. Hallucination is mostly consists of hearing his voice from your behavior. What mainly causes this disease is yet unknown to the scientists, but the most important one is the inherited factors, like our genes. Treatments are easy but effective, like families, therapies, medications, and psychotherapies.
Cut it? Okay.
3. The third category of symptoms involves changes in sleeping patterns and increased alertness. Insomnia is common and some people with PTSD have difficulty concentrating and finishing tasks. Increasing aggression and can also result. What is the treatment for PTSD? Medication can help with the depression and anxiety often felt by people with PTSD and assist them in re-establishing regular sleep patterns. However, therapy is generally felt to be more promising treatments for PTSD. Thank you.